Okay, let's start with the third paramyxo virus. That is mumps. The mumps is an acute contagious disease characterized by non-suppurative enlargement of one or both parotid glands. Other organs may be involved, including pancreas, testes, ovaries, as well as the central nervous system. More than one-third of mumps infections are asymptomatic. It is considered as a vaccine preventable disease. As I said earlier, these viruses, the paramyxoviruses, are characterized by antigenically stable, so it can be easily be prevented by vaccine administration. Although significant outbreaks have been occurred in recent years in developed and developing countries. وهذا الموضوع المهم حاليا على مستوى العالم، مو فقط بالمامس بالنكاف وإنما بالحصبة، على اعتبار انه النكاف والحصبة هي من الفاكسين بريفنتبل ديزيز، ويفترض انه انتهت، ولكن لسببين مهمين تظهر outbreak from time to time here and there في اماكن مختلفة من العالم. هذه الاوتبريك سببها اما failure in the vaccine or failure in the vaccination، وراح نجي نحكي على هذا الموضوع في سياق المحاضرة. The mumps virus belong to the genus Rubella virus in the family paramyxovirus and is seen to have a roughly spherical enveloped morphology of about 200 nanometer in diameter. It contains a linear single-stranded molecule of negative sense RNA. Genotypes. Although there is only one serotype of the mumps virus, according to the WHO June 2012, there are currently 12 genotypes, namely A, B, C, D, F, G, H, I, J, K, L, N, excluding the E and M. Additionally, there are several subgenotypes D1, D2, G1, G2, H1, and H2, which are designed by numerals after the letter G. After the letter G2 is the current subgenotype circulating in the Indian subcontinent. Among vaccine strain genotype A, genotype B, it is not clear yet if there is any clinical significance to the genotypes. Okay. Pathogenesis and pathology. Humans are the only natural host. Transmission is from person to person through droplet infection. A primary replication occurs in the nasal or upper respiratory tract epithelial cells. Viremia means the presence or the extension or the reach of the virus to the bloodstream, which disseminate the virus to the salivary gland and other organs. The involvement of parotid gland is not an obligatory step in the infectious process of mumps. The incubation period is typically about 18 days. Average is around 10 days after exposure. The virus shed in the saliva from 6 days before to 7 days after the onset of salivary gland swelling. About 1/3 of infected people are asymptomatic, but are capable of transmitting infection. The testes and ovaries may be affected, especially after puberty. 20% of males more than 13 years who are infected develop orchitis, which is usually or often unilateral, but only rarely sterility result. The virus frequently infects kidneys and can be detected in urine of most patients via urea. It means the presence of the virus in the urine lasts for 14 days after the onset of symptoms. Central nervous system is also commonly infected, even in the absence of parotitis, which is the inflammation of the parotid glands. Clinical findings. The most characteristic feature of symptomatic cases is swelling of salivary gland in about 95% of patients. Let's say the majority of patients with mumps develop swelling in the salivary gland after a prodromal period of malaise and anorexia. One parotid gland may be enlarged, or one gland may be enlarged several days before the another, and usually painful, especially when acid substances are chewing، خاصة لما الطفل أو الشخص المصاب يأكل شيء حامض. Mumps occur for 10 to 15% of aseptic meningitis. Cause meningoencephalitis usually occur 5 to 7 days after inflammation of the salivary gland, or it may occur at the same time or in the absence of parotitis. Aseptic meningitis means indirectly means viral meningitis. Aseptic means no bacterial infection. Mumps during pregnancy can be dangerous with an increased risk of miscarriage in the first 12 to 16 week of gestation. Rare complications include self-limited polyarthritis, pancreatitis. So it has been suggested that DM may be followed the pancreatitis. DM هو الدايابيتس ميليتس، داء السكري، واللي ينشأ نتيجة أما قلة إنتاج الأنسولين من البنكرياس أو عدم إنتاجه بشكل كامل، فهو تو تايب، البرايمري والسكندري. قد ينشأ نتيجة البنكرياتاتس اللي تحدث بسبب الممس. nephritis, thyroiditis, and unilateral nerve deafness, often complete and permanent. Deafness means طرش. Immunity. There is only one single antigenic type of mumps virus, thus immunity is permanent after a single infection. Antibody to hemagglutinin neuraminidase glycoprotein, F glycoprotein, and internal nucleocapsid protein develop in serum following natural infection. Even subclinical or asymptomatic infection generate lifelong immunity. Passive immunity is transferred from mother, thus mumps are in infant, usually develop in infant more than 6 months of age. Laboratory diagnosis. The laboratory test can be helpful in clinical confused cases because clinically the disease is very evident. The first steps is isolation, identification of the virus. Second, by serology, ELISA technique is the most sensitive and specific assay. Virus-specific IgM is detected in recent illness, indicate recent disease, and seldom lasts longer than 2 months. Usually, IgM تبقى شهر ونص 6 أسابيع إلى 8 أسابيع. The presence of virus-specific IgG antibody, which indicate immunity or past exposure or vaccination and the third way is molecular detection of the virus. Okay, epidemiology. Mumps occur endemically worldwide. Outbreak occur in close setting في المجتمعات المغلقة أو شبه مغلقة. The disease reach its higher incidence in children 5 to 15 years. In children less than 5 years, mumps commonly cause upper respiratory tract infection without parotitis. Mumps is highly contagious, that is to say, highly transmissible disease. Intrafamilial transmission is common، وهذه صفة أيضا ثانية موجودة وواضحة جدا في مجتمعنا. The virus is transmitted by direct contact, airborne droplet or fomites contaminated with saliva or urine. The mortality rate is low. وعليه فالطفل بالمدرسة لما ينصاب بالممس ينطوا إجازة لمدة 14 يوم لأنه يعدي الجماعة الأطفال اللي وياه الطلاب اللي وياه. Vaccination. Several strains are used to vaccinate against mumps. A live attenuated vaccine is available. The vaccine is recommended for children more than 1 year and for adolescents and unexposed adult. It is available as monovalent واحدة أو bivalent مع الروبيلا يسموه MR or trivalent مع الميزل والروبيلا يسموه MMR. MMR live virus vaccine produce antibody to each of the viruses in about 95% of the vaccinated people or children.